fight fire with fire, more like fight acid with base. This is acute salicylate toxicity, which is just like aspirin. Aspirin, salicylic acid. Yay. All right, so there's a kid who took a lot of it. They're going to be vomiting, tachypnea. They're going to be breathing really quickly, high anion gap metabolic acidosis. They're going to have a treatment of intravenous sodium bicarbonate. And the question is going to be like, hey, how does this help? Well, salicylate toxicity happens and it presents with primary respiratory alkalosis and anion gap metabolic acidosis. And so sodium bicarbonate is given so that you can convert this lipophobic ionized form of salicylic acid. That way it's trapped in the bloodstream, and then you can excrete it. So what do you see with this? Tinnitus, hyperventilation, anion gap metabolic acidosis. You see the with the treatment, with the antidote, sodium bicarbonate, you're going to be trapping it in the blood and you're going to alkalize the urine. So the renal excretion is going to happen. So 4-year-old, he ingested this stuff, he receives this. How does it happen? How does the mechanism work? Enhances renal excretion by increasing salicylate ionization. So it alkalizes the blood and the urine, promoting the conversion of the acid into the ionized form, which then cannot cross the membranes very well. Some other answer choices you'd see are going to be like stimulating metabolism, no drugs are going to be involved, lipid solubility, that's harmful, it increases the tissue toxicity. GI binding describes activated charcoal. It's like acetaminophen overdose you'd use it for. That's how salicylate acid causes toxicity, would be the blocking the phosphorylation, not how we treat it. Okay, so hopefully this is helpful. Decreased cardiotoxic effects. That'd be relevant for a tricyclic antidepressant. So sodium bicarbonate is also used to reduce the cardiotoxic effects of like a TCA overdose. Decreasing charge. So sodium bicarbonate actually increases the charge form of salicylate in the blood. That's how it works. It converts the lipophilic into a lipophobic ion, so it's trapped in the bloodstream. Increasing blood trapping in the gastric lumen. That's activated charcoal. That's for trapping the bloods in the gastric lumen. So activated charcoal is the GI drug. And acetaminophen. Increased excretion in the urine, yeah, that's good. Increased hepatic drug, glucuronidation. So sodium bicarbonate does not induce glucuronidation. That's a metabolic pathway not utilized in salicylic toxicity. So nothing, nada que ver con eso. Hepatic glucuronidation is not used to treat your toxicity. So anion gap, the vomiting, the breathing, tachypnea, tachycardia, you treat it with sodium bicarbonate. So you can trap it on in there, change the ionic form, more lipophobic, and then you just pee it out.